Hello everyone, I am Dr. Ramandeep. Today we are going to discuss aphorism number 5. Useful to the physician in assisting him to cure are the particulars of most probable exciting cause of the acute disease. Till now we had discussed the disease state, healthy state, then bringing back to cure, then about the knowledge of the physician. Now coming to the details of cause of the disease. In last aphorism, that is aphorism 4, we had discussed regarding the knowledge of the cause. When a patient comes to a clinic, comes to a homeopathic physician, what will be the first thing? We will be noting taking the symptoms of the patient and then observing the signs. Now what is to be evaluated at that time by homeopathic physician is to take out the cause of the disease. That is by taking the details of each and every symptom what the patient is telling. From there we'll come to know about the cause of the disease, because in homeopathic practice you will observe most of the successful treatments are when we select the medicine basically according to the cause of the disease. The cure percentage is higher. That is why the physician must have the proper knowledge of the cause of the disease, the particulars of most probable exciting cause of the acute disease. Now here there is concept of acute disease. Acute diseases can be classified basically into two types, acute and chronic. Now acute are the diseases which are of the very short duration, that is maybe lasting from 7 to 10 days approximately, and then chronic, the diseases which are lasting for more than that period of time, that is acute disease and chronic disease. Now here we are taking the discussion regarding the acute disease. What happens is, very simple example we can take, the person is having common cold, coryza like symptoms. These arise mostly due to exposure to cold. When some person takes some cold drink, then after taking cold drink or exposure to cold, he is having the cold symptoms. Now what is that? Exciting cause. Exciting cause is something or some circumstances which are responsible for the arising of that acute symptoms, that present symptoms of the patient, which are of the very short duration. Means since very short duration back, those symptoms or those causes which are responsible for that disease condition or present symptoms are the exciting cause. Particulars of most probable exciting cause of the acute disease. Now what is to be taken in detail is, those symptoms are also to be taken in detail, and what is the possible exciting cause in that particular patient, as also the most significant points in whole history of the chronic disease. The next thing is what we discuss is chronic disease. Now chronicity may be many years, standing also maybe up to 1 month, 2 months, or many years also, because long standing diseases, they are all included under chronic disease. Most significant points in whole history of the chronic disease. Now in last aphorism also I discussed, we had what homeopathic physician has to do, taking the symptoms, then observing the signs, then going to a lab investigations, then reaching up to clinical diagnosis. Now this whole case taking is to be done. Whole case taking criteria is given in further aphorisms of Organon of Medicine. We have to do case taking according to the listing given in Organon of Medicine. Now when we do the case taking, in that we take the details of acute symptom also, then details of symptoms arising due to some related to some chronicity, means the symptoms or the problem which a patient may have suffered since long. We'll take the details of each and every symptom, details including particulars of that particular symptom, means when the symptom that problem get aggravated, that is problem get increased, then when he's feeling better, what are the factors, those are called the modalities that we'll discuss in further aphorisms. Means each and every detail of the case has to be taken in acute case as well as in chronic case according to the proper criteria of the case taking. Important points in whole history of the chronic disease. Now history include details of each and every symptoms of the patient to enable them to discover its fundamental cause. Now here comes the next cause. First we have discussed exciting cause. Now next is the fundamental cause. Fundamental word itself makes it very clear. Fundamental means the cause or the factor which is basically responsible for that disease condition. Now in homeopathy, here we'll take in short, we will have the discussion in next videos. Fundamental cause includes the basic thing which is responsible for the present disease condition. Now according to homeopathy concept, we'll discuss a term miasm, that is whatever factor is responsible for any of the disease conditions surrounding us. That includes a fundamental cause, means what is the basic cause of the disease. Something is responsible, including environmental factors, including lifestyle, including all these things. According to homeopathy, that is classified as three things: psora, syphilis and psychosis. Means some symptoms, many of the details are included under one category, which is called the psora. Means mental symptoms, physical symptoms, each and every detail of one particular person which can be responsible for some disease condition, those are included under psora. Then syphilis, related to destructive things or destructive changes. Then psychosis, related to some warts, figs, then any external growths arising on the body. This is just simply I'm touching the topic. We'll take in detail the miasms in further aphorisms. Fundamental causes, means physician must have the proper knowledge of fundamental cause of the disease also, means what is the basic responsible factor for the present disease condition. Because psora is the basic thing taken in homeopathic study. Psora is responsible for all the disease condition. From psora, it is believed that other two conditions, syphilis and psychosis, are arising, which are leading to the disease. Now, two causes we have discussed: fundamental cause, and first we have discussed regarding the exciting cause. Exciting cause was the cause which is responsible for the present disease condition: exposure to cold, or exposure to taking cold drink, or any other such factor. In these investigations, ascertainable physical constitution of the patient, especially when the disease is chronic, ascertainable physical constitution of the patient. Here comes another term, very important term, constitution. Now in homeopathic practice, you will see sometimes the medicines are, and mostly the medicines are selected according to the constitution. Constitution means whole makeup of a person, including mental symptom, physical symptom, his pattern of sleep, his pattern of sitting. As a physician, as a patient comes to a clinic, now physician observes his walk, manner of sitting, manner of talking, the words he uses, these all, then his desires, aversions, each and everything which are personally included to that particular person, that is included under constitution. Ascertainable physical constitution of the patient, especially when the disease is chronic. Now in chronic cases, this detail has to be taken under what type of constitution that patient is included. For example, you will see some persons who get each and every complaint whenever they will be exposed to damp weather, whenever they are taking some cold drink. What we say as sensitivity also means that particular person is very sensitive to cold. He is always getting cold symptom. His pains are getting aggravated whenever he is going to some cold place, or his pains are aggravated when he is taking having intake of cold things. Now this is exposure to cold, exposure to damp weather. This is particularly related to that particular person, that is included in constitution. Hydrogenoid constitution. Hydro means related to water. When his complaints are aggravated, wherever water related conditions are there, which is helping in increasing his disease condition. Similar are the different types of constitution. We'll take in detail further aphorisms. His moral and intellectual character. The next is moral and intellectual character. That is what we study under category of mental symptoms. When we have the details of case taking, first and most important category will be the mental symptoms. Means when the patient comes to you, we have to take out the mental symptoms. We will have the long list of questions. What is the basic protocol according to given in Organon of medicine? We'll do that case taking. We'll find out, we'll take out the mental symptom, what is the basic cause of the present disease condition behind. There must be some underlying grief, there must be some underlying sorrow, must be underlying some stress conditions. Each and every mental symptom is to be taken out. That is moral and intellectual character also. Moreover, his intelligence. Now, how will take out that intelligence? His way of talking, his way of expressing his symptoms, then his way of relating his symptoms, how he is presenting his problem. His occupation, next thing is occupation, then mode of living and habits. Where he is living, what are the conditions there, then what are his basic habits which are a part of his life, his social and domestic relations, how he is behaving in society, how he is behaving in with his near and dear ones, his age, then sexual function, etc. has to also be taken into consideration. Now his age factor also matters, because according to age also we are going to select the potency, we are going to select the doses also, because sensitivity or predisposition to some disease also varies according to the age of a person. Now that's all about aphorism 5. and we'll take the explanation of by Dr. Kent in next video. So please do like, share and comment if you have any queries regarding the topic discussed. Thanks for watching.